information, but it kind of sums up kind of the long and short of everything. The recovery period's pretty quick. Most of the bone is kind of starting to reform and heal back together within about 6 weeks' time. You would treat him like you would a normal baby. You know, you're not going to drop a normal baby. You're not going to let a normal baby smack their head on the wall or anything like that. You're going to give the same care. You don't need to like handle everything like a piece of china. You know.
Okay. Until he gets his helmet
with
on?
or without the helmet. You just, you know.
But when there's no helmet on, there's a big hole there, right?
You just treat him like a regular kid, you know. And, you know, you're not going to let him get into trouble as a 5-month-old. You're not going to let him get into trouble anyway. His soft spot's already there as a baby, and, you know, you're just going to have like a giant soft spot. You just treat him like a giant soft spot. You can touch his head. It's going to be mushy. You can wash it with soap and water. Once you get home, you'll be able to wash it in a day or so, okay? And you'll be able to just wash it like your regular shampoo, soap, and water.
How long did you say the hospital stay was?
It could be anywhere from 1 day to however long it takes to.
So usually like 5 days.
It can be as long as 5 days, but often it could be 1 or 2 days. You know, if everything looks good and he's not doing bad, then by 2 days, frequently they can be out of there. You know, so you know, I wouldn't necessarily bank on that, but it is a possibility, and you know, he'll guide when he's ready to go home or not.
Okay. Now the lady we went this morning for his first scan for the cat and for the helmet, and she
Ari?
Elena and Ari, I guess that's the other one. Is that her name?
Yeah.
I forgot.
Sure.
She said sometimes, because I asked, that there is a possibility of a second surgery with the endoscopic. Why would that be?
With the endoscopic or a second helmet?
Second surgery.
Yeah. With any of these surgeries, kind of like I said before, they could refuse. We could be unhappy with the shape. We don't like the way the growth is or whatever, then we could have to go back and redo it.
And how soon after? You don't know?
It probably would not be ultra soon.
No,
unless there was a complication, like one of the plates broke or, you know, a piece of bone moved or something was unsatisfactory that I've kind of outlined in the complications. You know, then we could have to go back a little early.
Generally, if a second surgery was necessary, like, is it months apart? Is it years apart?
It would generally be months to, you know, a year, you know, something like that.
No.
So it generally is.
But you really wouldn't know until the time came where it was necessary.
And the chances of that are pretty low. You know, I don't know if I've ever gone back for a sagittal synostosis. I don't think I have. Other than maybe an infection. You know, I recall one infection in one of my cranial ball remodelings where kid just got infected under the scalp, and I had to take it back, wash it out, and it did fine. But you know, that's a rarity. I haven't had, you know, infection. Generally I give 1 dose of antibiotics in the OR, and then I don't give any other antibiotics unless they manifest some evidence of infection. And that's generally how I do the antibiotic thing. So when you go home, you just be on his regular Tylenol and Motrin.
Alright, so basically the day of surgery you guys will decide which procedure to do, or
the day of surgery will start endoscopically, and if it's just too hard, then we'll convert it to an open. You know.
Oh, so then he in the end might not even need the helmet.
If he gets an open one. Unless you guys say, you know what, we don't want to deal with the helmet, just do an open. And then we just do an open one. But, you know, I've given you the pros and cons. It's really your decision. I don't necessarily think one's better than the other. I think they both have pros and cons. You know, so I think they're both good surgeries for the problem, and they both,
I'd rather do the
you know,
one
have
with
a good
less
effect.
blood loss.
So
the endoscopic.
Yeah, I think in general you probably overall have less blood loss.
But do we ask about the brain bleed? If he has a brain bleed and you're doing the endoscopic and you took it out, how fast can you get in there to fix it?
We just open it, you know. Yeah, we go from a closed to an open, and we get right in there and take care of it.
What are the risks of a brain bleed? Like,
I mean, we're working.
Has it happened to you before?
Yeah, absolutely. So in even in I recall one where we got into the sinus, you know, where the significant amount of major bleeding can happen. And basically we took a little bit of muscle from the side of the head here, and while one of us held a finger there, we put a patch, which is a common thing that we do, or we could use other types of patches to over-sew that and put it together, you know, and that kid did absolutely fine without any problems. You know, have I had more than that one? I can't recall any major bleed other than that one tear that we had. But that can happen any time. It's a risk, and, you know, you could bleed to death from that. I mean, those are risks, you know. Chances of that are not huge, you know. But it can happen, you know. I mean, we're as careful as humanly possible. We know what we're working around. We know what we're doing.
Rodriguez is there?
Well, Rodriguez is doing all the neurosurgery part of everything, you know. So that involves kind of protecting the brain, keeping the brain away from the bone while we're working on it. You know, it's all done as a team.
I didn't understand, like, how 6 hands are going to be.
Oh, it works.
You know what I mean?
I think it's amazing.
There'll be more than 6.
I know, but
we'll have a resident or 2 in there helping retract and stuff, and we'll have anesthesia in there, and, you know, there'll be a bunch of people working.
Yeah.
So, and that's you know, most of it. So I don't know what
you don't think we should do it any sooner than the 2 weeks? You think we should be okay?
Yeah, I think it should be fine. I think the problem with doing it sooner is just coordinating even just neurosurgery and plastic surgery, you know, and so it's about picking and finding the amenable date. Do I think 2 weeks is going to make a difference between now and then? No, I don't.
Yeah.
Would a month make a difference?
Yeah.
Maybe. 2 months?
His
Yeah.
head has, like, I'm sorry. His head rapidly has changed a
Yeah,
lot.
and it will. That's typical, you know. So, and that's pretty much it.